Chronic pain can have a major impact on our quality of life. And a very common pain we might experience as we move into midlife and beyond is joint pain. This pain can be very limiting, affecting our mobility, comfort, and everyday activities. Joint pain is typically managed with medications and even at times might require surgical interventions. These interventions help a great deal. However, our food choices while experiencing these symptoms also play a key role in management. Certain foods can increase inflammation and aggravate joint pain. Even certain foods considered as highly nutritious, consumed by some individuals, may trigger pain symptoms. Understanding how food affects joint health allows us to make better choices. If you or someone you care about is experiencing joint pain, stay with me for the next few minutes as we explore how smarter food choices may help alleviate the burden joint pain can cause on our quality of life and wellness. Hi, I'm Dr. Francisca Osage. Thank you for joining me on Francisca on Health Matters. Joint pain is a common symptom associated with a variety of medical conditions or disease processes. It could occur briefly, during, or after an illness, in which case it is described as an acute joint pain. Or it may persist for months or even years, in which cases is described as chronic. Now, acute joint pain typically is caused by trauma or physical injury to a joint, certain infections, or short-term inflammatory responses, while chronic joint pain is most often linked to long-standing disease conditions. Now, although the underlying causes and mechanisms of joint pain vary, joint pain is mostly driven by an inflammatory response, which manifests as pain, stiffness, and reduced joint functioning. Now, management typically includes pharmacological interventions with pain relievers such as acetaminophen, non-steroidals such as ibuprofen, steroidal agents, immune modulating therapies, and in some cases, surgical interventions might become necessary. Alongside these treatments, lifestyle modifications, particularly dietary changes, are an essential component of joint pain management. When evaluating joint pain, it is important to consider its underlying cause. As we age, joint pain may develop because of osteoarthritis, a condition caused by the gradual breakdown of joint structures due to repetitive motion and mechanical stress. This breakdown is especially pronounced when the tissues that cushion and protect the joints, such as the cartilage, begin to deteriorate. Osteoarthritis typically becomes more noticeable after the ages of 50 and most commonly affects the hips, knees, ankles, and other weight-bearing joints. And over time, this degenerative process can activate an inflammatory response which contributes to pain, stiffness, and reduced joint function. Joint pain can also be a manifestation of autoimmune disorders, a group of conditions in which the body's immune system mistakenly attacks its own tissues. In these disorders, immune-driven inflammation targets the joints, leading to pain, swelling, stiffness, and progressive joint damage. This inflammatory process is well documented in conditions such as rheumatoid arthritis, systemic lupus erythematosus, psoriatic arthritis, Sjogren's syndrome, polymyositis, scleroderma, and polymyalgia rheumatica, among other autoimmune conditions. Unlike degenerative joint conditions, as in osteoarthritis, autoimmune-related joint pain is typically a result of systemic inflammatory response that is involving other parts of the body. As a result, joint pain occurs alongside other manifestations involving skin, muscle, and internal organs. Common accompanying symptoms include fatigue, skin rashes, muscle weakness, easy bruising, and involvement of organs such as the lungs, eyes, and cardiovascular system. Another common cause of joint pain involves the deposition of crystals within the joint space, a process described as crystal-induced arthritis. The most well-known form is gout, which occurs when compounds in the form of crystals known as monosodium urate crystals form and accumulate in joints. These crystals develop when levels of uric acid in the blood rises above its solubility threshold, leading to crystal precipitation and a strong inflammatory response within the joint. Elevated uric acid levels may result from increased dietary intake of certain foods said to be rich in purine, or underlying medical conditions that impair the kidney's excretory function. Gout most commonly affects the big toe during an acute attack, although other joints can also be affected. While degenerative, autoimmune, and crystal-induced processes are among the most common causes of joint pain, it's also important to recognize that joint pain may also arise from trauma or injury, certain systemic illnesses, infections, including sexually transmitted infections. Inflammatory processes set in during these conditions, causing, among other symptoms, pain. Thus, consuming foods that are pro-inflammatory tend to worsen pain and should be avoided or minimized. So let's look at some popular foods that can trigger joint pain during these processes. Under the pro-inflammatory category will include refined sugars and sweetened foods, sugary beverages, refined grains, baked goods made with refined flour and sugar, highly processed foods, high-fat fast foods, fried foods, saturated fats, trans fats, red and processed meat, excess sodium, alcohol, high fructose foods and drinks. Similarly, foods that are anti-inflammatory can help alleviate joint pain. Therefore, foods of benefits will include fatty fish such as salmon, mackerel, trout, sardines, cruciferous vegetables including broccoli, cauliflower, Brussels sprouts, kale, berries including strawberries, blueberries, raspberries, nuts and seeds including walnuts, chia seeds, flax seeds, beans and legumes, whole grains including quinoa, brown rice, oats, green tea. Joint pain of gout is due to crystalline deposits which also trigger an inflammatory response. It typically occurs suddenly, and the character of pain is often described as severe or burning pain. When crystalline deposits are the sources of pain, we try to avoid or minimize our consumption of foods that will lead to elevated levels of uric acids. And these foods will include organ meats like liver, kidney, red meat, such as found in beef, lamb, pork, shellfish, as found in shrimps, crab, lobsters, certain fish, as in anchovies, sardines, mackerel, tuna, cod, alcohol, especially beer, sugary drinks with high fructose. Whatever the cause of joint pain, as much as the right foods can help manage symptoms, always consult with your healthcare provider so you can receive the best management plan suited for you. And I hope this helps you in making the best choice regarding your health. However, let's hear your story in the comments section. And please don't forget to like, share, and subscribe if you're yet to subscribe and you would like to receive more of my wellness content. Thanks for watching. Again, I hope you found this informative and educative. And if you've had, please like and subscribe. And I'll see you in the next one.